Ostomy care is for patients with ileostomy and colostomy. I would first introduce myself. Next, I would identify my patient by two patient identifiers, their first and last name and their date of birth. Great, what they said matches their chart. Next, I would explain the procedure. We will be performing ostomy care today. We will be doing application and removal, and I'll walk you through the procedure. Next, I would encourage questions, and I would wash my hands for the allotted recommended time and put on clean gloves. Next, before performing removal and application, I would assess the ostomy pouch. You are supposed to remove the pouch within 3 to 5 days and until it's 1/3 full. So this ostomy pouch is 1/3 full and it's been 4 days. So I note the color, the consistency, the amount, and how long it's been on. I would then unclip my ostomy pouch and drain the contents into a container. I would note the amount, the color, and the consistency. Next, I would assess the stoma area. I would assess the color. Is there any irritation or swelling? Any trauma? Is there any healing or irritation going on? So there's no healing. Well, there's somewhat of healing because this patient just had it done, and it's the normal red-pink shiny color. So then I'm able to remove the ostomy bag. I place the patient in a semi-reclining position, and I provide a Chuck's pad to place under the patient for protection and dignity and comfort, and to protect the linens. Now I am able to remove. I would identify my patient again just to make sure I have the correct patient before starting the procedure. I would identify them by their two identifiers, their first and last name and their date of birth. They have restated that, and I've checked their chart, and it does correlate. So now I'm able to remove the ostomy pouch. Making sure I don't irritate the skin, I pull slowly towards the skin, so it's comfortable for the patient also, so it does not harm them. So let's say I have tossed this into a bin, but I have not used this because this is my only ostomy pouch, so let's say this is a new one. Now I would document the drainage and the amount that came out of the pouch, and I've documented that, so now I can assess the stoma area. Is it red? The color, the consistency, is there drainage? Is there any swelling or irritation? So this stoma looks great. So I've already washed my washcloth, or I've already dampened my washcloth with warm water. Not soap, because that could be irritating. So I cleanse around the peristoma area, making sure I do not irritate it. And next, I'm able to trace my stoma. Excuse me. I have my measuring device here. And with an actual measuring device, it would be a more accurate measurement. But let's just say this bigger circle is what fits our stoma. I would then trace it. I would go over here and get a pen. And I would trace it. So it's at 20 5 milliliters, or millimeters, sorry. So I would then cut around my traced circle, making sure I don't have any sharp edges. I would then toss this. Then I am able to remove the adhesive, making sure that I don't pull it too much so the adhesive still stays intact. Then I would apply now the ostomy pouch and the wafer. I would make sure I press down the edges, making sure the adhesive stays. Then I would ask my patient to press down also to warm the area, which allows the adhesive to stick better. I would then clip my ostomy pouch, and I would throw away any used materials. I would then document, and I would place my patient in a comfortable position, and I would ask if they are comfortable, and I would then document. I would have also provided a mirror during the entire procedure so the patient could watch. I will then document and remove my gloves, throw them in the trash, and then I would provide teaching for my patient, and then I would have them re-demonstrate the procedure, making sure they understand how to perform application and removal.